Hello everyone. Today I'm going to discuss about the vital signs examination in the clinical diagnostics subject. So today in this topic I'm going to discuss about the what are the important vital signs such as the temperature and blood pressure, pulse and respiratory rate. How we are going to assess how we are going to check these vital signs and what is the importance of these vital signs in the clinical examination. So first I'm going to discuss about the vital signs. So these vital signs are these signs are measure of the body metabolic functions, especially the most basic functions are these vital signs. The four main vital signs routinely mentioned by the medical professionals and also healthcare providers. So the major four vital signs are the body temperature, pulse rate, respiratory rate, and also blood pressure. So these are the major vital means very most important in our body. So whenever you get any patient, any related to any condition, is a musculoskeletal problem or a neurological problem or cardiovascular system or any system problem, if the patient comes to the clinic or in the hospital, first foremost thing, important thing is first one is assessment of the vital signs. How is the body temperature? How is the pulse rate, respiratory rate, and blood pressure? So we have to check. So coming to the, if you see the normal range of the all these vital signs, it will be vary to person and also according to the age group. So we are going to discuss one by one. So how it will be in the age group. So if you see in the, so these are the major pulse group and also vital signs: pulse, respiration, temperature, and blood pressure. So if you check these, like in the new in the newborn, so is more than 96 hours. So that means more than 4 days. So the pulse will be in the 70 to 190, respiration will be 30 to 60, temperature will be 96 to 99.5, blood pressure will be is a 60 to 90, and also 20 to 60. That is the diastolic pressure. This is systolic pressure. So this is about the newborn, but in the adult it will be totally different. That is this one is you can go through once according to the age wise. The readings are different. So in the if you see in the adult, so the pulse will be in between the 60 to 100, and also respiration is 12 to 20, temperature will be the 97 to 99, and systolic pressure will be the 90 to 120, diastolic pressure will be the 60 to 80. But if it's the age grows, only the blood pressure is going to be increased and also is going to be a little bit altered here. First I'm going to discuss about the body temperature. So if you see in the body temperature, so these vital signs are very useful and also detecting or monitoring the medical problems. So majorly we are going to detect the any medical conditions or medical problems. Also vital signs can be measured in the medical setting or at home or the side of the medical emergency or elsewhere. Anywhere you can check. For you, you no need to get the very expensive equipments. Only thing is for the body temperature, we have to get some equipments, and blood pressure also we have to check the equipments. And also pulse rate and respiratory rate, no need to get the any like any equipments, we can measure anywhere. So these vital signs we can check in the hospital and also clinical setting, at home or in the emergency, everywhere we can check these vital signs. So coming to the body temperature, if you see the normal body temperature, the normal body temperature range from the 97.8 degrees of Fahrenheit to the that is equal to the 36.5 degrees of Celsius to, and also 99 degrees of Fahrenheit. That is the, so if you see that is going to be 36.5 degrees centigrade to 37.2 degrees centigrade. That is in the healthy adult. So it may be vary to person to person. Just now we saw in the infant and also adult, the temperature range is going to be vary. And also some other problems or any other complications, it may alter the body temperature. So normal body temperature of the persons vary depending on the so many reasons. So that is the gender and also age and recent activities. So we are going to discuss one by one. Okay, first one is the age factor. So how age factor is going to alter the body temperature? So if you see the age factor, just now we saw the newborn having the unstable body temperature because their thermoregulatory mechanisms are immature. So that's why it's not going to be same. It's not constant. It is not uncommon for elderly person to have body temperature is less than 36.4. So if anybody having less than 36.4, so it indicates hypothermia. So they may chance to get the other complications. Remember that this fact when the evaluating the low grade temperatures in the elderly are identifying those at the risk of for the hypothermia. So if anybody less than 36.4 centigrades, so it indicates the hypothermia. Thermia means the temperature, hypo means less temperature. So it indicates, but it will be vary to person to person. And also next one is the environment. How the environment is going to be alter the blood pressure and also body temperature. Ordinarily, the changes in the environmental temperatures do not affect the core body temperature. So, our surroundings, the like if it is cold or weather, cold weather or is a hot weather also, the core body temperature it won't affect because of the our brain hypothalamus and also our skin, our muscles are going to maintain the core body temperatures. So our heat loss and also maybe heat gain may be different according to the temperature, but according to the weather. But the core temperature will be the normal. There is no changes. The degree of changes rates to the temperature, humidity, and the length of the exposure. And also, it may alter if someone is working in the high temperature seasonal, like outside to expose to the sun, or maybe how much time they are exposed to the sun. So it may alter the body temperature. The body thermoregulatory mechanisms are also influential. So that means the infant and older adults have the diminished control of the mechanisms. So body regulatory thermoregulatory mechanisms. So our thermoregulatory mechanisms controlled by the our blood as well as our brain, especially is hypothalamus, is controlled our body temperatures. So if anybody having the problem in the brain, so may alter the body temperature. And also if having like any infections or it may alter the body temperature. So these are also is environmental factors. So in case of if death may occur if the person core body temperature drops into the 25 degrees, if any person's body temperature is less than 25 percentage or maybe is more than 45 degrees centigrades, the person is going to be die. So it's because of the it's a serious conditions, they may chance to get the brain damage and also may chance to get the mortality. So coming to the day of time. So day of time, the body temperature normally fluctuate throughout the day. Normally from the morning, afternoon or evening is going to be fluctuate different. Temperature usually lowest around the 3 a.m. in the early morning at 3 p.m. 3 a.m. is going to be lowest. Then the in the evening times at the 5 and 7 p.m. in between the 5 to 7 p.m. So why they are getting the low blood body temperature at the 3 a.m. in the early morning? Why it is going to be increased? So because of this, at least the 2% is going to be vary. So this temperature is going to be less because of the they're going to be in the morning time and also afternoon time. Whatever we eat and our physical activities, so it also useful and also it may generate the body temperature. But it's going to be in the morning time. These activities are going to be less, and also our digestion of the food also going to be finished. So there is no activity in our body. So that time the body temperature is going to be very low. Even greater variation in the body temperature at various times in the day found in infants and children. So depends upon the body, the outside the activity or day activities in the children and also in the kids, it may alter the body temperature. So next about the exercise, how the exercise is going to be where in the change in the body temperature. So the body temperature increases with the exercise because exercise increasing the breakdown of the carbohydrates, fats to provide the energy. So if the breakdown of the fats and also carbohydrates, so it release the energy. So this exercises are going to be is improving the body temperature. So if you see the exercise persons are such as the marathoners who can practice marathon regularly. So during the marathon time, they are going to reach the marathon means like a full marathon, 42 kilometers. Who are going to run more than 42 kilometers, their body temperature is going to be increased because of the breakdown of the carbohydrates and also fats. So it's going to be around reach the 40 degrees. But if the normal person get the 40 degrees, is we feel like a hyperpyroxia. That means it's like a high temperature. It's like a fever. But in the athletes, this is going to be the normal in the because of the exercise progression. And also one more important factor is stress. Emotional or physical stress can elevate the body temperature. When stress stimulated, sympathetic nervous system, circulating levels of epinephrine and non-epinephrine is going to be increased. That is a hormonal changes. So because of the epinephrine and also non-epinephrine also going to be increased, because of the increasing the hormones also affects the body temperature. So as a result, metabolic rate also increases, which in turn in the increases the heat production. So metabolic production is increased means whatever we are going to take the food and nutrients, everything is going to be digested. The energy portion is going to send to the bloodstream. From the bloodstream is going to the tissues. The waste products are going to be excreted to the excretory system, to the kidney, and also the digestive system. The remaining that time is because of the breakdown of the carbohydrates and fats is going to produce the heat. So this stress or anxious clients may have an elevated body temperature with no underlying pathology. There is no underlying causative factor, no infection, no stress, no other complications, but their body temperature is going to be increased because of the hormonal imbalance. So next one is the hormones. So these hormone also plays an important role in our body regulating the body temperature. So these hormones also, especially women, usually have greater variations in their body temperature than the men. So because of the hormone progesterone is a female hormone secreted at the ovulation time. So increase the body temperature at least more than is 6 to the 1 Fahrenheit. So is going to the 1 that's a 0.5 to 1 Fahrenheit to the baseline then the compared to the women and men. Why? This is because of the progesterone hormone. If the progesterone hormone release, so the body temperature is going to be rise, but it will be up to some extent. So at the age of 50, so the women will get the menopause stage. So after the 50 years of age group, women and men both are going to get the same body temperature. So this is the difference between the men and women because of the hormonal changes. And also other problem is the thyroxine, epinephrine, non-epinephrine also elevates the body temperature by increasing the productions. So if also this thyroxine hormone, epinephrine, non-epinephrine also it helps to and also it may increasing the body temperature. So it alter the temperature. And coming to the next one is if a when we are going to check the body temperature, if the person comes to the clinic, so what are the methods we are going to use the this body temperature measurements? So these things we can check with the orally, and also we are going to check in the axilla. The thermometer we are going to keep it in the axilla, and also we are going to put the thermometer into rectum. So this is mainly for the kids. It's a best method for the kids. So these methods are useful to measure the body temperature properly. Orally, the temperature can be taken by mouth using either the classic glass thermometer or modern digital thermometers. Use the electronic probe to measure the body temperature. So it may be glass thermometers, the classical like a classic thermometer is a glass thermometer. So inside the mercury is there. So this mercury is going to like gives the readings according to the body temperature. And nowadays many changes in the according to technology. Now we are getting the digital thermometers, which one I am showing in the image. So this one is if you give this thermometer, if you put on in orally, so it gives the recording. Let's send the temperature in the display. And also this is mainly for the suitable for the mainly for the adults. This armpit is mainly for temperature for the is going to be for the kids as well as we are going to for the adults. And also rectal temperature. The temperature taken rectally, so by using the glass or digital thermometers. So it's going to be tend to be 0.5 to 7 degree Fahrenheit, then taken by the mouth. So it will slightly variant to the mouth and also rectum. But the best method is if you want to check the exact body temperature. So rectal insertion is the best method to know the temperature. So and also auxiliary temperature. So this auxiliary temperature can be taken under arm by using a glass thermometer or maybe digital, anything also. But here also going to get the difference is going to be 0.3 to 0.4 Fahrenheit lower than the temperature by the mouth. So it's slightly lower than the mouth temperature. But whenever we apply these like a thermometers, we have to take some precautionary measures before applying, before giving the thermometer. We have to sanitize and also we have to clean the thermometer. Then we can give to or we can put into the mouth or maybe axilla or rectum. Otherwise, it may transmit the infections, so it may spread to the others also. And also another method of the temperature method is by ear. So nowadays most of the people are using the infrared hearing like a temperature measurements. So in this pandemic situation, I think most of the people, everybody understood or everybody knows about the this like a infrared like a thermometers. So this is like a infrared. So here is going to special thermometer can quickly measure the temperature of the eardrum, which reflects the body core temperature. So they're going to put in the tympanic membrane in the ear. For the adults, we have to measure the temperature, pull ear up to back, and for the child, pull ear down and back. And it is easy to measure, and also compared to the mouth, and also compared to the rectal and axillary. This method is going to find the temperature very easily. And also next one is the we are going to check the thermometer by the skin. The special thermometer can quickly measure the temperature of the skin of the forehead. So the temperature may be abnormal due to the high fever. So if it is abnormal, so it is we call referred as the high temperature, also called as fever. So these are the ways to measure the body temperature. So hypothermia is defined as the drop in the body temperature is below the 95 degrees. So that means if the body temperature is less than 36 centigrades, so we call as the hypothermia. So these are the some methods how to measure the body temperature in the kids as well as in the adults. So, what are the abnormalities of the hypothermia? What are the body temperatures? So, these abnormalities just now we discussed. So, is hypothermia and also hyperthermia. Hyperthermia means the body temperature is less than 36 degrees centigrade, less than 95 Fahrenheit, 95 degrees of Fahrenheit. So, this hypothermia is due to so many reasons. Is alcohol or drug use, that is if anybody take more alcohol or any drugs also going to the body becomes cool. And also hypothyroidism, the thyroid hormone levels are going to be increased, inactivity of the thyroid. Anorexia means if there is no sufficient amount of the food, if no hungry, so they are going to become weak. So that time also there is no proper blood circulation, those people are going to get the hypothermia. In case of stroke patients, the cerebrovascular accident, so they are going to get the body temperature is going to cool. And also sepsis, in case of any infection, also may chance to get. Parkinson's disease, this is a neurological degenerative disease. Nerve damage, in case of nerve damage, there is no proper signals to the muscles, so and also tissues, so there is no proper blood circulations. And also malnutrition, if there is no proper nutrition, may chance to get the body temperature becomes cool. And also some medication, especially some antidepressants, antipsychotics, sedatives. So if anybody having for example any stress or anxiety, doctors are going to prescribe some anxiety medications, some depression medications. So if these medications are going to depress the central nervous system, so in those conditions our body regulation of the body temperature regulation is going to be altered, so they may chance to get the cool temperature. And also in case of anesthesia, so during any surgical procedure, if they don't want to know the pain, so doctors are going to give the anesthesia, so that means to avoid the pain. So this in these conditions they will get the hypothermia. So and also hyperthermia or maybe is increasing the body temperature. So we called as the fever or are also called as pyroxia. So this is condition if it is body temperature is more than 104 Fahrenheit degrees or more than 40. So we call as a very dangerous hypothermia. Sorry, very dangerous fever. So if it is more than 900 degrees, we call as the normal fever. So that is going to be subside within 1 or 2 days. But if it is more than 104 degrees or more than 40 degrees centigrade, it may lead to the brain damage or sometimes may chance to get the mortality. But according to the statistics and according to the readings in the history, in the 1980s, And also Willie Jones, she's in the Atlanta. She was admitted in the hospital with 115-degree Fahrenheit. So she spent more than 24 days in the hospitals and she survived. So after that, she got the Guinness World Record. So because this is the highest body temperature, that is the 105, that's sorry, 115 body temperature, and also she was stayed almost 24 days in the hospital and she survived. Normally, if it is crossed more than 107 degrees, it is going to affect to the brain and also may chance to get the mortality. But she is the first lady, and also she got the and also, sorry, he got the 115 centigrades, and also he survived. So that is the reason he got the world record. So coming to the pulse rate. So if you see the pulse rate is measurement of the heart rate and number of the times that the heartbeats per minute. So if you check the pulse, we are going to check the heartbeat in 1 minute. And the heart pushes the blood through the arteries. That arteries expand and contract the flow of the blood. So that means because of the artery contraction and relaxation, so the blood is going to pump from the central to the periphery. So it's going to give the pulsations. So these pulsations we are going to found to know the heart function. So these pulse rates are going to be, so we are going to take the in different levels. Using this pulse not only measure the also heart rate but also indicating the heart rhythm and strength of the pulse. So not only heart rate, and also we are going to check the heart rhythm. Is it the normal heart rhythm? Is it some heart rhythms are going to be abnormal? In case of arrhythmias means heartbeat is going to be fast sometime, after some time very slow. Or maybe conduction block disorders. AV conduction, atrioventricular conduction block, or maybe sinoatrial conduction block. So these are all problems are because of the atrioventricular conduction blocks. Or this SCN node. SCN node is the pacemaker of the heart. Pacemaker is it gives the electrical signals to send the conduction throughout the heart. So if any damage in the any breakage in the atrioventricular walls or maybe in the conducting system of the heart, they may chance to get the abnormal heart rhythms. So it will produce the abnormal heart and also pulse also. So we can may chance to get the absence of the pulse or maybe the bounding pulse. That means we can feel the pulsations outside. We can clearly palpate the pulsation outside. So that is also bounding pulse. So the normal pulse for the healthy adult ranges in the 60 to 100 beats per minute. This is the normal range. So if it is crossed more than 100, so it is the abnormal pulse, or if it is less than 60, also abnormal. So where we can get the all these abnormals, and also how we are going to like where which places we are going to find these pulses. The pulse rate may fluctuate at it and also increase with exercise, illness, and also injury and also emotions. So this pulse rate also going to be altered according to the situations. And also, so as the heart forces the blood through the arteries, you feel beats by firmly pressing on the arteries. So that means while pressing, if you use the two fingers over the wrist joint, just proximal to the wrist joint, we can feel the pulsation here. So this is nothing but is the radial artery. Why we are getting the pulsation in the radial artery? Why means the radial arteries are going to give the pulsations compared to the veins, because the pressure slightly increased in the arteries than the veins, because the veins having the lumen size bigger size, so the pressure will be less. Artery has the less lumen size compared to the vein, the pressure will be more. So we can found the pulsation in the arteries only. That is also that arteries also, which arteries are superficial, especially in the arm, in the forearm, we can found the at the wrist joint for the radial artery pulsations. So many different places we can found. So these pulses are temporal pulses, facial pulses. Temporal pulse in front of the superficial temporal artery. So temporally here we are going to pulses. You can place your the hand at the temple region. Here you can feel the pulse. And also facial artery at the angle of jaw. Facial artery also you are going to found facial artery. Here you can feel the pulsations. And also the carotid pulse. We can find the carotid pulse at the neck region. Axillary pulse in the axilla, we can feel the pulsation. You can feel the like a pulse sensations. And also next one is the brachial plexus. So in the cubital fossa, middle border of the biceps, muscles and brachial artery. So here you can meet middle side. Here is the rate, the brachial plexus. So this, sorry, brachial pulse. The brachial pulse, we are going to the uh, cubital region. There is a in the elbow region, cubital pulse is the right side medial. So here we can found the brachial pulse. So the most commonly, most of the healthcare professionals, doctors are going to found the radial artery pulse. Most commonly, they are going to check in the wrist joint. In some cases, they are going to do the dorsalis pedis artery, and also femoral pulse. They are going to find femoral pulse in the thigh region. Dorsalis pedis is going to get the foot in the dorsum of the foot, and also tibial pulse. They are going to check in the posterior tibial artery, backside of the ankle. So these are the places where we are going to find the artery pulsations. You can check and also you can go through one by one. And also during a practical time, you have to feel the pulse. You have to place your fingers over all the artery places. You have to feel the pulsations. How the pulsations are there is going to be the rhythmic or abnormal or normal. So sometimes the pulse is going to be like a double bind. So we are going to discuss what are the different type of the pulse. So just now we discussed temporal pulse. You are going to palpate it in front of the ears. Here in the temporal pulse, carotid pulse in the neck region, brachial plexus either in the arm. So brachial pulse, and also radial pulse at the wrist, and also apical pulse in the. We can check with the stethoscope near the apex of the heart. Here also we are going to find the heartbeat at the apex region. So femoral pulse will be feel at the either side of the groin. So we are going to the groin regions below the inguinal region. So we are going to find the femoral pulse. Popliteal pulse behind the knee region. So and also this also important. Pedal pulse, also called as dorsalis pedis artery, located on the top of the foot. So if the foot is there, the foot over the dorsum of the foot, we are going to find these pulses. So what are the abnormal pulses? So we can feel the different pulses. So first one is the pulses deficient. Pulses deficient means is going to be abnormal. The pulse rate is less than the heart rate. For example, heart rate is normal. Heart rate is 80 beats per minute. For example, if the pulse is less than like a 80 beats per minute or is a by more than less than 80, so it indicates the pulses deficient. The pulses deficient occurs in the atrial atrial fibrillation. Atrial fibrillation means, so just now we discussed the conduction like a block, especially is the atrioventricular block, or because of the conducting system of the heart, sinoatrial node, AV node, or bundle of his. So if there is no proper conduction, there is no signals in the heart, so if there is no proper contraction of the heart muscles, so these pulses deficits may chance to get. This condition is called atrial fibrillation. Atria is going to become fibrillation is going to be sometimes going to be fast contraction, sometimes going to be slow contraction. So this is because of the sinoatrial node and AV node. So both having the problem. So those people are going to get the pulses deficient. Pulse is going to be less or deficient. And also next one is the weak pulse. Weak pulse means sometimes if you palpate here, you may won't get you won't feel the pulse. So these conditions, it may be in case of the hemorrhage. Hemorrhage means decreasing, sorry, the blood volume. So because of the bleeding, if the heavy bleeding, or maybe in case of severe chill, if the weather is so severe, if they're stuck in the any like a freezing countries, so those time it may get the weak pulse. Sometimes you won't feel the pulses. The another condition, another abnormal pulses are the pulses paradoxa. So pulses paradoxa means sometimes the pulse is going to be very strong. If you feel it here, the pulse is going to be easily found, and also sometimes it's going to be very weak. Strong and weak, strong and weak. So this type of the pulsation changes is commonly seen in the cardiac tamponades. So that cardiac tamponade means if any fluid abnormality in between the pericardial sac or pericardial space, so they may chance to get the pulsus paradoxa. So coming to the respiratory rate. So respiratory rate is the number of the breath a person takes per minute. So how much of the respiration, how many breaths per minute we are taking. So that number is called as the respiratory rate. The rate is usually measured when the person is at the rest and simply involves in the counting the number of the breaths per minute by counting the how many times the chest rise. So if the, normally without our conscious we are going to take the breath. So but that time we cannot count how many times we are repeating. How many breaths we are count our having the we have the breath. So in this one, we have to concentrate and also we have to check how many breathings, how many inhalations and exhalations. So that he will be the respiratory rate. In 1 minute, how many times you are taking? Breathe in and breathe out. You have to observe how much time you are breathe in and breathe out. So that things normally will be 12 to 20 times per minute in the normal adult. But it may vary depends upon the age group and also it may depends upon the their health status. So normally is it higher here 12 to 16 breaths per minute. So until 20 also normal. So it will be the also normal. So what are the factors affecting the respiratory rate? So age and also medication, stress. So same like in the body temperature and also this also going to be altered everything. So age also normal growth from the infancy to the adulthood results in the increasing the lung capacity. So in the infant, so the breath rate is going to be increased because that time the lung capacity is not fully formed. But the lung capacity increases, the respiratory rates are sufficient to exchange the air. So that is the reason if they've grown up, the respiratory rate is going to be decreased only 12 to 20 times. But if you see in in the infant and child, it will be more than 30 times per minute. So that is the difference between the age group. And also some medications such as the narcotics. So these narcotics decrease the respiratory rate and depth. So especially is the sympathetic drugs is albuterol can use to dilate the bronchioles. So in case of the restricted bronchial disorders or maybe is the restricted lung diseases, in those conditions the person is the bronchioles are going to be constricted. So in those conditions the doctors are going to give the medications. So these medications are helpful to dilate means to make the bigger size the bronchioles. So this one also is going to be is is also going to be alter the respiratory rate. So and also next one is the stress. Stress are strong emotions. Can also respiratory pattern because the conditions stimulate the sympathetic nervous system. So including the stress are also pain, anxiety, infection, and fever also increasing the depth of the respiratory rate. So that's the reason if you see if anybody crying or if they are emotional or if anybody met with any like a accidental news. So sometimes if they cry, they are going to get the difficulty in breathing, or they are going to their breathing like a breath count is going to be increased because of the emotional stress. And also exercise. So this exercise also plays an important role to strengthen our respiratory system. So exercise, when the people exercise, their tissue consuming and also process more oxygen. And also exercise produce the extra carbon dioxide and also heat that body must eliminate. The body respond to these needs by increasing the heart rate and also depth of the respiration. Sorry. So if you do the exercise regularly, so what happen if you do the exercise, the oxygen is going to supply to the tissues, carbon dioxide going to release it. So that's the reasons. So they have to breathe out continuously, breathe in and breathe out. So the respiration rate is going to be increased. So in case of exercise, the respiratory rate is going to be increased. And also altitude. So this is also very important while assessing the patients. If any patients from the high altitude or who are living in the mountain regions, so their levels are going to be respiratory rate is going to be decreased because that oxygen concentration, oxygen levels are going to be very less. So in those conditions also, in those conditions, the respiratory rate is going to be decreased. And also gender. So because of men normally have the larger lung capacity than the women. So that's why men having a lower respiratory rate. So lung capacity is more. So because of lung capacity is more, respiration is no need to exchange continuously. The respiratory rate also going to be decreased. This is why that is going to be totally contrast to the kids. Kids lung system is not developed fully, so that's the reasons they are going to take more respiration rate. Is a high respiratory rate than the adult. So next important thing is the blood pressure. So this blood pressure also very important. So nowadays many people are facing with these complications with the age with the young age also. So many people are getting the high blood pressure because of the current environmental and also their lifestyle and also work environment also make them into the high blood pressure. So if any patient comes, first we have to check the blood pressure. How is the blood pressures? The blood pressure measured with the blood pressure cuff and stethoscope. So that means we are going to check the blood pressure with the specialized equipment. The equipment is called as sphygmomanometer. Sphygmomanometer. It is the force of the blood pushing against the artery wall. So the pressure is going to be against the walls of the blood vessels. So in the blood vessels, there are three different layers are there. So blood vessel made up of tunica intima and tunica media and tunica externa. These three layers are there in the blood vessels. Along with this one is smooth muscles, elastic fibers, epithelium. So these structures are there. So there, because of the smooth muscle, the blood vessel is going to contract and relax. So because of the contraction and relaxations, it may use the pressure inside the blood vessels. So then we can find the blood pressure. So each time the heartbeat is, and also it pumps blood into the arteries, resulting in the highest blood pressure in the arteries to contract. If you compare the arteries and veins, the pressure is going to be very high in the arteries than the veins because artery size, the lumen size is going to be lesser than the veins. So that is the reason the pressure is going to be more in the arteries. That is the reason. So we have to check the blood pressure only in the arteries, not in the veins. Both the systolic. So the blood pressure will be two stage. That means two types we have to measure. The first one is systolic pressure and also diastolic pressure. So what is mean by systolic pressure? What is mean by diastolic pressure? We will discuss. Systolic pressure is nothing but is the contraction of the ventricles. So that means the squeezing of the blood to from the heart to the other blood vessels such as the aorta and also pulmonary artery. Dilatation, there is a diastolic means filling stage. The blood is going to enter into the ventricles. That is nothing but the filling stage. So these are the two types of the blood pressure: systolic blood pressure and also diastolic blood pressure. So, according to the National Heart, Lung, and also Blood Institute, the normal blood pressure will be 140 to the and also 140 is the systolic pressure, 90 is the diastolic pressures. So, according to the this National Heart and Lung Blood Pressure Institute, so it mentioned normally actually 120 stroke 80 is the normal, but now because of the day-to-day changes, lifestyle changes, all these things, now they give the normal one is the 140 is the systolic pressure and also 90 is the diastolic pressure. So if anybody, the new blood pressure category was added called the pre-hypertension. So that is 120 and also 80 mmHg is called as the pre is a hypertension. So that means they are near to reach to the pre-hypertension. So if anybody reach more than these things, so they may chance to get the hypertension in the future, not in at the same time. So if you see the systolic blood pressure, just now we discussed. So that defined as the maximum pressure exert in the during the arteries during the systole of the heart. Systole means heart contraction. So during the contraction time, how much the pressure is there? The pressure is called as the systolic blood pressure. So during the relaxation time, R is the filling stage, so is called as the diastolic blood pressures. So the diastolic pressure will be is the 60 to 80. So normally the pressure will be the 80. So if it is more less than these things, so it may called as the hypotension. So how this blood pressure is going to be affects according to the some variation, some factors. Okay, if you see that according to the age factor, this blood pressure is going to be altered. Just now we saw the temperature, same like the blood pressure also going to be altered. So in the systolic pressure, so it will be see in the newborn, it will be only 70 mm of Hg. Normally is the normal adult is a more than 140, right? So 120 and 100. So that is the, but if in the newborn, it will be only 70 mm of Hg of the systolic, and diastolic will be the 40. But if you come to the puberty, it's going to reach to the 120 and also is going to reach to the 80. So this is the normal after puberty, that's a normal blood pressure. So if the puberty, if anybody having less than like a 100 or maybe 80, so it indicates they're having the hypotension symptoms. Hypotension means the less pressure in the blood vessels. Or it reach to the, if it is the, in case of puberty, if anybody crossed 140, they're having some other complication related to the blood pressures. So these things we have to measure carefully. So we have to diagnose the pre-hypertension stage, hypertension stage, and also we have to check the what are the dangerous hypertension stage. That means a malignant hypertension. So we will discuss what are the different types of hypertension. We'll see in the next slides. So next one is the sex, and also in the females and males, how the difference will be there. So the arterial pressure is going to be at least 5 mm of Hg is less than the males at the same age. So if you see here, so the females, the pressure is going until the menopause, the pressure is less than the men age group. But after the menopause, after the menstrual period stop, so the pressure is going to be same in the both ages, both age group as well as the both genders. The male and females are going to be, because of this variation is because of the hormonal changes, because of the progesterone. Just now we discussed the thermometer temperature, right? So there also, because of the this progesterone hormone also plays an important role in the blood circulation and also blood pressures and also body build. In the obese, the pressure will be more than the lean persons. Why? Obese is nothing but obese when they're going to get obesity because of the fat accumulations. If the fat accumulation in the blood vessels, so automatically it gives the resistance, it may gives the high blood pressure and also diurnal variations. So in the morning, the pressure is slightly low compared to the afternoon and also evening. In the evening, the pressure is going to be increased because of their physical activity and also the after meal also the blood pressure is going to be increased and also during the sleep the blood pressure is going to be decreased, but if they get any dreams the pressure is also going to be increased. That is the variations to the normal sleep and also if anybody having the dream sleep, so who are getting continuous dreams and all these things, so they may chance to get the disturbance of the sleep and also may alter the blood pressure, may chance to get the other complications and also emotional conditions such as the anxiety and depression also increasing the blood pressure level. These are all due to because of the release of the adrenaline hormone. So this adrenaline is giving the emotional imbalance, so that means it increasing the emotions, it may increasing the blood pressure. Okay. So coming to the after the exercise, how the blood pressure is going to be increased. So after the exercise, the blood pressure is going to be increased because of exercise increasing the cardiac output. So because of the cardiac output, the blood volume also going to be increased. If it is increased, the pressure also going to be increased. So after the severe muscular exercise, at least 40 to 50 mm of Hg is going to be increased. That's the reasons. In case of like a athletic people, the blood pressure is going to be high during the exercise time. So if it is exercise, they are going to get the more cardiac output and also oxygen supply. So that's the reasons its oxygen supply is going to increase to the tissues. Sorry. So after severe muscular exercise, systolic pressure rises at least minimum 40 to 50 mm of Hg at the basal level. But the diastolic pressure reduces because of the peripheral resistance decreases in severe muscular exercises. So the diastolic pressure is going to be decreased, but is systolic pressure is going to be increased. So these are the variations in the physiological variations of the blood pressure. So how the factors are maintaining the arterial blood pressure? So these are the major factors are the local factors are there, which is the cardiac output and also is the heart rate. So this cardiac output also increasing the blood pressure, because if the cardiac output is increased, pressure also increase. Output means how much the blood is pumping one side. So that also it alter. So these blood pressure, cardiac output is going to be interrelated. If the cardiac output is increased, blood pressure also increase. So if you see these things, cardiac output, heart rate, peripheral resistance, blood volume, venous return, viscosity of the blood flow, and also velocity of the blood flow, viscosity of the blood flow is directly proportional to the arterial blood pressure. How directly? If the cardiac output is increased, blood pressure increase. Heart rate is increased, blood pressure is increased. Peripheral resistance, inside the blood vessel, if any resistance increase, pressure also increase. Resistance due to any fat accumulation, any obstruction of the foreign material, so the blood pressure is increased. And also blood volume is increased. If the blood volume means the amount of the blood is increased, so the if the amount comes a lot, so they have to push more pressure with pressure lead, so the pressure also going to be increased. Venous return, if the venous return is increased from the lower limbs, it reaches the right atrium, so the if the load is comes to the right atrium, automatically the pressure is going to be increased. And also velocity, if the blood speed is increased, pressure also increased. Viscosity means thickness of the blood. If the blood become thick, the pressure also going to be increased. So this is all is interrelated. And also inversely proportional, especially the elastic fibers and also diameter of the blood vessel. If the diameter is bigger size, so the pressure is less. If the elastic fibers are more, the pressure is less. If the elastic is there, if the elastic is there, elastic is going to be expand. It's a stretchable. So automatically the pressure will release. If the no elasticity, the blood vessel become the very stiff. If the hard, in those conditions, the blood vessel cannot expand. So it's going to get the more pressure inside the wall or blood vessels. So that is the difference between the in the artery, the pressure is going to be increased. Why? The lumen size is going to be increased than the veins. So these are the some factors maintaining the arterial blood pressure. So what are the pathological variations of the blood pressure? So pathological variations are just now we discussed. What is the normal blood pressure? Normal blood pressure is less than 100 and like at 40 until from the 120 to 140 is the normal range in the systolic blood pressure, and also is 80 to 90 is the normal diastolic pressure. If any changes are these things, it is called as the hypertension or hypotension. So coming to the hypertension, first one is we have to see the hypertension. Hypertension is defined as the persisting high blood pressure. So more blood pressure. So it's around the more than 130 or 140, and diastolic pressure is the above the 90 is called as the hypertension. Hyper means the blood pressure is going to be increased. So this hypertension is divided into the two categories. First one is the primary hypertension, also called as essential hypertension. Second one is the secondary hypertension, primary and secondary. Why it divided into the primary and secondary? Primary means normally they are going to get the blood pressure, high blood pressure, but there is no causative factor. If any patient comes, if you check the blood pressure, the blood pressure will be very high. But if you rule out the causative factor, you we cannot find the rule out properly because of there is no exact causative factor for the blood pressure. So this type of blood pressure is called as primary hypertension, also called as essential hypertension. So this is the unknown reason. So there is no proper reasons, but they are going to get the hypertension. So this type of blood pressure is called as is the primary hypertension. So again, this primary hypertension is going to be divided into the two different types. So the first one is called as the benign hypertension. First one is called as the this primary hypertension is divided into two categories: benign hypertension and also malignant hypertension. Maybe you heard about the benign tumors and malignant tumor. Benign tumor, it won't spread to one part of the other part, but it may give the complication. It won't give much complication if it is not growing properly. It's only grows, but it won't give the damage to other parts of the body. It won't spread. Same like here also, benign hypertension is the person is going to get the high blood pressure, but there is no causative factor, but there is no symptoms also. The symptomless course. They are going to get the symptomless course. That means they won't get any other complications. The blood pressure may be increasing to the 200 systolic pressure, and also above 100 is going to be diastolic pressure. But after some time, the blood pressure is going to come to the normal in the resting condition. But in some cases, if the ages progression, if the ages goes, so this pressure is not controlled, but in the future they may chance to get the other complications. So that means in the initial period, the symptoms are less. That means the symptomless is course. But if the age progress, these if it is not controlled, so it may chance to give the develop the cardiac problem, vascular problem, and renal problem. So this type of hypertension is called as benign hypertension. So it won't like a symptomless course, but in the progression they may chance to get the symptoms. So next one is the malignant hypertension. Malignant hypertension, also called as, is a fatal disease or fatal type of hypertension. That means is going to get the severe like the range of hypertension. The blood pressure is going to be high, is going to be accelerated. So because of these conditions, progressively affect to the cardiac diseases and also renal diseases. So these are called as auxiliary hypertension. So this is going to be the systolic pressure is going to reach until the 250, and diastolic pressure will be the 150. Normally, if any person get more than 180 to 190, those persons may chance to get the stroke. Those persons may chance to get the damage of the blood vessel, damage of the brain because of the rupture of the blood vessels. So the condition is called as is the hemorrhagic condition or hemorrhagic stroke. So in case of 250 also, if it reaching means the persons may chance to die immediately, and also within the short duration of the time the person may chance to die, and also it may affect the other organs of the body. So this is a very dangerous conditions. It is always developed due to combined effect of primary and secondary hypertension. So causative factor as well as the unknown causative factor because of the any infection or any damage of the blood vessels, any narrowing of the blood vessel, any atherosclerosis, the blood vessel thickening, and also the blood vessel closing. So these are also causative factor. Sometimes there is no proper causative factor. So combined together, it may give the malignant hypertension. So because of this malignant hypertension, the organs like eye, that is retina, heart and brain, kidneys, these are the major like vital organs are going to be affected. So it may damage, it may chance to get the death. So that's the reasons this malignant hypertension also called as a fatal disease. Fatal means death. So that's all about the this is about the primary hypertension. And also so coming to the secondary hypertension. So secondary hypertension means so it's having the proper causative factor. So primary hypertension there is no causative factor, but the secondary hypertension we know the causative factor. So why they are going to get the hypertension with a known reason. So this one is going to be known reasons are going to be if anybody having the cardiac problem. So especially is the atherosclerosis. Cardiovascular means atherosclerosis. Atherosclerosis means the blood vessel become very thick. The blood vessel is become the thick with is a deposition of the fatty deposition or plaques deposition. So if the deposition of the blood vessels, there is no proper blood circulation, so the lumen size is going to be decreased. So because of the decreased lumen size, so the pressure is going to be increased. If you imagine this is the blood vessel, yeah, like a lumen. So in this condition, if the lumen size is normal, the blood flow very easily. If it because of the obstruction of the fat or because of the anything here, if any damage here, so if any compression, any narrowing here, so what happens? There is no proper blood circulation here. So this is going to give the high blood pressure. So next one is the coactation of aorta. Coactation of aorta is the congenital abnormality of the blood vessels. Aorta becomes the narrowing. The aorta becomes very small size or short or narrowing. So in this condition, there is no proper blood circulations. So those people are going to get the high blood pressures. And also other like endocrine disorders. If anybody having any tumors in the medulla, or maybe is the if any high excessive secretion of the catecholamines, so that is going to be the any tumors in the endocrine system also alter the blood pressure, and also excess secretion of the aldosterone and also adrenal cortex. If any hormones are very high, so alter the blood pressure, increase the blood pressure. Next one is the excessive secretion of the glucocorticoids in the adrenal cortex, in the adrenal gland. If the cortex is secretes the more, so they may chance to get the Cushing syndrome, that is called as Cushing syndrome. So these are the disease conditions. So if anybody having these diseases, automatically they are going to get the hypertension, that is the secondary hypertension. Other than these diseases, another causative factors are the renal hypertension. If anybody having kidney artery stenosis, kidney artery stenosis means narrowing. If the artery is the small size, if there is no proper way to blood circulations, in those conditions may chance to get the hypertension. And also neurologic hypertension. Neurologic hypertension, if anybody having any tumor in the brain, increase the intracranial pressure, or maybe any like a CSF, cerebrospinal fluid is accumulation inside the brain, so may chance to get the this hypertension. So these are all are the secondary complications of the hypertension. One more important thing, secondary complication is hypertension during the pregnancy. So some women may chance to get the hypertension during the pregnancy time, because this is because of the toxemia, or maybe because of the low glomerular filtration rate, GFR, that is in the kidney filtration rate. If there is no proper filtration in the kidney in the during the because of the retention of the sodium and water in the pregnancy, because of the physiological changes, these things are going to be happening. And also one more thing, and also another hormone is going to be released from the placenta. So this hormone is mainly is help in the is plays a major role in the vasoconstriction agent. So these hormones from the placenta means the covering layer to the baby, the newborn baby in the uterus. So these things are going to so release, and also it alter the blood pressure. So if the once the women deliver the baby, if the placenta and also remove from the uterus, their uterus, so automatically the percentage of the hormones are going to be balanced, and also it's going to reduce the blood pressure. It comes to the equal. So this is the pathological variations of the blood pressures. So another pathological variation is the hypotension. So hypotension is the decrease the blood pressures. So decrease the blood pressure. This also two types of the blood pressures. So this is the primary hypotension and also secondary hypotension. So primary hypotension means there is no proper causative factor, same like the hypertension. So this is also no reason, but they are going to get the less blood pressures. So this is called as essential hypotension. So another one is going to be the secondary hypotension. Secondary hypotension is due to the causative factor, is a known causative factors. So known causative factors are the main known causative factors, the myocardial infarction, that is the decrease of blood circulation to the heart muscles, and also hypoactivity of the pituitary gland. Pituitary gland is the master gland of our body. So if any hypoactivity, there is no activity, if the function is less, so it may chance to get the blood pressure, low blood pressures. And also hypoactivity of the adrenal gland. So if you know no proper secretion of the adrenaline, and also infection, tuberculosis infection, and nervous disorders. So if any neurological disorders, so may chance to get the hypotension, that is the decrease the blood circulations. So this also same like the hypertension, two types, primary hypotension, and also secondary hypotension. Primary, there is no known causative factor, but these people are going to face the like a always tiredness and weakness. But if they take rest, again they are going to get the normal. But only thing is, one more important factor is the orthostatic hypotension is the this is the major complications. It may give the health issues. So sometimes the person may chance to get the giddiness, may fall down because of these things, may chance to get the head injuries. What is the orthostatic hypotension? Orthostatic hypotension is sudden fall in the blood pressure while standing for some time. If, for example, this is most commonly seen in the bedridden patients. If any patient complete bedridden on the bed continuously because of the spinal cord injury, the person unable to sit, unable to stand, unable to walk, so continuously on the bed. If suddenly the patient get up from the bed to and sitting pose, or if someone make them into the standing pose, automatically they're going to get the giddiness. Why? So continuous bed sleeping on the bed or supine lying positions, the the blood flow will be altered. The pressure going to be altered. If they get up, the blood has to pump against the gravity. So in the standing position, blood has to pump upwards. So it's a difficult. So the blood circulation is going to be decreased. So this condition is called as orthostatic hypotension. So this condition most commonly seen in the myasthenia gravis and also neurological disorders who are on the bedridden and tabes dorsalis, syringomyelia, and diabetic neuropathy. So these conditions maybe you will learn in the next further semesters. You can learn clearly in the detail in the next semesters. So that's all about the today topic. So these are the major the examinations of the vital signs. So blood, first one is the body temperatures, pulse rate, respiratory rate, and also blood pressures. I explained a little bit detail. So why you have to differentially diagnosis. This is very important. If anybody comes with a known cost factor or unknown cost factor, you have to differentiate. That is the importance of the diagnosis. If you diagnose properly, so then only can give the treatment properly. We can give the treatment properly. So that is the reason here I explained clearly about the what type of the pathological changes, how it's going to be altered, what are the causative factors. Hopefully you understand about the vital signs examinations. If you have any doubts, you can send a message. I can clarify your doubts. No worries. Thank you very much. That's all about your topic.